Thanks, Paul. Thanks again for the opportunity to come here and have a chat. I'm a physiotherapist, and I'm just one small part of the team that Paul's been talking about, and we really do want to emphasise that this is a team approach that we're going through in guiding you all the way through this surgery and the full recovery. So my chat's going to be quite small. I'm really going to go and have a chat about what we're doing prior to surgery, what happens to you directly after surgery, and then the continuing physiotherapy and maintenance and improvement of your quality of life as you improve post-surgery. So if we look at the pre-operative surgery, we're looking at having probably a couple of sessions with you prior to your surgery, and the first one is really to have a little assessment of your fitness. Now, what we'd like you to do is to come in as early as you can. We like to get people in sort of 6 to 8 weeks prior to surgery, and the first thing we like to do is to do this individualised fitness assessment on them. And one of the first things we like to look at is your cardiovascular fitness, which Paul has talked about earlier. And that's really your ability for your heart to pump the blood, and it's really important that we can make some gains in that 6 to 8 weeks prior to surgery. If we can improve your cardiovascular fitness, it has been proved that you will recover much quicker from surgery. So that's one of the things we do. We'll have a little look at that and give you an individualised program. It might be something like a simple walking program, it might be a pool program, or it might be a bike program. But it will be individualised to you, for you specifically, and be appropriate to you and your condition. Again, as Paul has talked about, we need to look at upper body strength. And in the early days of having a knee replacement, you really rely a lot on your upper body, and we do find that as we get older, we're deconditioned in this area, and it's really important for us to do some strengthening prior to surgery so that you can cope with lifting yourself in and out of the car and using the crutches. So that's really important. We'll also look at some strengthening exercises for your knee here or around your hip if we're talking about hip surgery as well. So we'll give you a specific set of strengthening exercises that are pre-surgery, and then we'll give you some specific exercises that will be post-surgical. Again, looking at trying to strengthen all around those joint areas that we're going to be replacing. We also have a look at your flexibility, and you find as you get older, a lot of people lose that flexibility, and that's really important for our recovery post-surgery. So you'll be giving an appropriate stretching program as well. Now, these 2 sessions that you'll have prior to surgery are your chance to ask us as many questions as you want. And this is a really important part of this, that you have time to talk to the physiotherapist, and they can allay any fears you've got with any of the recovery or any part of the surgery. So that's probably the first session that we'll do. The second session is probably more of a teaching session. And one of the things I always find difficult for people is generally they don't learn to walk on crutches until after they've had surgery or they have some problem. And it's really difficult to learn then. So we like to get you in and we teach you how to walk on crutches. And it's a little bit of an art and takes a little bit of practice. And particularly trying to get you to learn to go up and down stairs, really quite difficult to manage. And if you can learn that prior to any surgery, then you'll be in good stead once you've had the surgery. It is really difficult to teach you how to walk on crutches and go up and down stairs when you've got a painful joint that's just been replaced. So we can fit you with a set of crutches, and we can get you to practice that actually prior to your surgery. The other thing that's important post-surgery is that you learn to do some breathing exercises. Because what tends to happen once you're in surgery is the lungs tend to shut down a little bit, and we really need to show you how to take some deep breathing exercises and make sure your lung function is fine post-surgery. Specifically, we'll teach you how to go from sitting to standing and standing to sitting once you've had a joint replacement, how to get in and out of a bed, and how to get in and out of a car. Because all these things are really quite difficult. And again, if you know how to do it and you can practice it prior to your surgery, you're going to be much better off after your surgery. We'll have a little review of the strength exercises that you've been doing. Make sure you're doing those okay. And again, it's an ability, a time for you to ask any questions, okay? use the physiotherapist. They've seen lots and lots of these operations before. They're there to help you, and just one little small part of this team effort. So now if we look at the role of the physiotherapist in the hospital, you're probably going to be in the hospital anywhere from sort of 4 to 7 days. Your physiotherapy will start within a day or so after surgery. And the most important thing that we look at early on is regaining movement. Okay, very, very important that we get range of motion early on. And particularly with your knee replacements, the thing that we need is your ability to straighten your knee, extension. We don't worry too much about bending your knee, that comes pretty well over time by itself, but you need to be able to straighten your knee and get full extension to walk properly. So the physiotherapist will work with you in the hospital to particularly get range of motion. So you will have that physiotherapist there. It will probably be a different person than you've seen before because it will be a hospital-based physiotherapist, but they will go through all those exercises that you've been previously given in an attempt to get you up and going as soon as possible. After discharge. Now, and I know Paul's alluded to this, but it is very normal for these to still have a lot of pain after you've had your surgery. You need to expect that, and it will continue for some time, but it will be controlled by your medication. Now straight away, as soon as you discharge from the hospital, you need to be continuing with your home exercise program, the one that you were given prior to surgery, and you will need to attend physiotherapy sessions. Some people need 1 session a week, some people might need 2 sessions a week initially, but that will drop off over a couple of weeks as we get you going. Within 3 to 4 weeks post-surgery, we'll get you in the hydrotherapy pool and get you working in the water. So the water is a great way to recover, and we generally find nice hot pools in Canberra to work with, and you'll find you'll get great value out of working in a pool. By 4 weeks, generally most people have gone from the crutches to a walking stick. By 6 weeks, your compression stockings will generally come off. By 6 weeks, we can usually get you back to driving a car if you've got good muscle control. Okay, now that will all vary depending on what surgery you have and who you are, but generally around about 6 weeks we're looking at getting you back to driving a car. Between 8 to 12 weeks post-surgery, we're looking at returning to light work. Now by light work here I really mean office type works. If you're a manual worker, then it's going to take a significantly longer time. But generally office type work, walking around, that's no problem around about the 8 to 12 week mark. By 3 months, we should have you back full walking. Good chance that you can return to light sports like golf, bike riding. Bowls is generally one that we can get you back to, but sometimes a little difficult if it's particularly the knee that you drop down on to bowl with. If that one's been the one that's been replaced, then sometimes it can take a little bit longer than 3 months. But generally we're looking at about 3 months getting you back to nice light sport activity. And basically for regaining full strength, you're looking at around about the 6 to 12 months. So that will differ with every individual. So in summary, which is pre-op physio, we're looking at trying to get your heart working a little bit better, setting you an individualised program. We're looking at your upper body and lower body strength so that you can manage with the crutches and moving around early. And we're looking at stretching your lower limb. Hospital physio, straight after surgery we'll regain early movement. And that's all I have for you.